Amber and I work for TriWest Healthcare Alliance. TriWest is the contractor that implements the TRICARE program in the West region, which is blue in the map behind you. If you are moving or live in the North or South region, they have different contact information. It has the May We Help You brochure. On the back, it has this map. It also has, there's 3 basic ways to get a hold of somebody in our company. First way is to go on our website at triwest.com. Second way is to call our toll-free number at 1-888-TRI-WEST. We have customer service reps there that will be able to answer your questions over the phone. It is a voice interactive response system, so you want to make sure that you say customer service, and you will get patched through to a person eventually, I promise.
I've never had any problems with that.
That's good to hear. Good to hear. So you have that option available. We also have service centers in throughout. There's one in Bloomington and right next to the Mall of America. That's actually where my office is. You can come in and sit one-on-one with a rep like myself. There's one on Grand Forks Air Force Base. That's probably the closest to you guys. And there's also one in Minot Air Force Base. So if you go, you can sit one-on-one with a rep, and they can help you with any claims, issues, questions, anything like that. So to find the one closest to you, you just go on our website and it's find a TSC, TRICARE Service Center, type in your zip code, and it will tell you which service center is the closest. So today we're going to talk about the coverage after your service member is deactivated. Okay, so service members and their families are eligible for 180 days of transitional coverage. So it's 180 days from the day that they are deactivated. That deactivation date is going to vary dependent on how much leave time your service member has left. Each one of you could have a different deactivation date, but starting on the deactivation, you have 180 days of TRICARE. We do read off of DEERS, so you want to make sure that all of your information is up to date in DEERS. Okay, and DEERS is where you get your ID card, so you want to make sure that you check with them to make sure that everything is accurate. Now we're going to go over what the coverage actually is. If you open up this brochure, there's 2 sides. It's an active duty side and a retired side. You want to make sure that you're on the active duty side. So automatically, service members and family members have TRICARE standard. Okay? So whatever program you're on right now, Prime or Prime Remote, that goes away, you automatically have TRICARE standard. With TRICARE standard, you should
the TRICARE standard was 180 days. You go from Prime Remote to standard.
To standard.
Okay.
Correct. Automatically, no matter what program you're on right now, you have TRICARE standard. Your service member does as well. When you're in TRICARE standard, you can see any certified or authorized provider. Certified or authorized is just meaning I went to school, I have my degree, I'm a doctor. It's 97% of the doctors in the United States. You just need to ask, do you accept TRICARE? Okay, so for that 180 days, again, it's TRICARE standard. When you go to the doctor, you see there's no enrollment fee, but you do have a deductible. The deductible is waived because your service member was activated as part of a contingency. We are waiving the deductibles. So you do not have to pay those at that time, but you do have to pay cost shares. It's an 80-20 split. We pay 80% of the charges, you pay 20% of the allowed charges. When I say the allowed charges, let's say your bill is $800, we come in and say, nope, you can only charge $300 for that service. You're paying 20% of the $300. We pay 80%. Everything above that is a write-off or adjustment. We don't worry about it, and you don't worry about it. Okay? So you want to make sure that you're paying 20% of our allowed amount. You also have middle cone, which is TRICARE Extra. So you have standard, you're using extra when you see a doctor in our network. Okay, a doctor that actually signed a contract with TRICARE. It saves you 5%. Okay, so you're paying a 15 split now, we pay 85 versus the 80-20. Okay, so you have standard, you're using extra when you see a doctor in our network. Network providers can be found on our website, or you can ask the doctor's billing department, did you sign a contract with TRICARE? Okay?
So that would be like TRICARE?
It would be what?
TRICARE.
I'm not sure if Medicare in this area is in our network. You would have to ask the billing department.
Yeah.
Medicare.
Okay. As the
Because right now that's where we're using, so I figured it's moving the same.
Okay. Just because they accept TRICARE right now under the prime remote that you're under does not mean that they're actually networked with us. Doesn't mean that they're not going to accept it, so you may be under the standard column, okay? But if they sign a contract with us, because right now you can pretty much go wherever you want, whether they, they have to accept it, but they don't have to be networked with us to do what you're doing now. But it changes, okay? So to save 5%, ask the billing department, did you sign a contract with TRICARE? So again, the deductible is waived on that one as well. Use your military ID card when you go in there, your dependent ID card. If you live around a military treatment facility such as Grand Forks, we have prime service areas around Grand Forks, Minot, or in the Twin Cities area. We have zip codes. If you live in our zip code list, you can choose to enroll into TRICARE Prime. Okay, Prime Remote goes away. So if you're under Prime Remote right now, you're no longer eligible for that. When you enroll into TRICARE Prime, you will get assigned a doctor. You have to go to that doctor for all of your routine care. If you need specialty care, they will do referrals and authorizations for you. Okay, so standard and extra are automatic. You do not have to enroll into them. You don't have to pay for them. Under the Prime option, you do have to enroll into that one if you live in a Prime service area. Okay? When you look down that column, everything is free. When you go to your primary care manager that you're assigned to, they will do all of your routine care. If you need the specialty care, they will do referrals and authorizations for you. Any questions on that part of it right there?
The prime is based on the location. Prime remote and prime have to do with where you were living.
Where you are living. Prime remote is if you live and work more than 50 miles away from a military treatment facility, but under that transitional coverage, you're no longer eligible for the prime remote program. If you live around a military treatment facility, you can enroll into the prime care.
Okay. Are we talking about the living, or are we talking about where the duty station is?
It's living and working more than 50 miles away from a military treatment facility.
Well, because we have a lot of soldiers that say live in Moorhead and are taking our family readiness group, but their soldier actually is in Crookston, which is within 50 miles. So they live here in Moorhead. So
live and work to be eligible for prime remote. Okay. But prime remote goes away during this anyway, so
right.
if you're under a prime remote right now, you're no longer eligible for that. So. Okay, pharmacy. Service members, when they were activated, their pharmacy was free no matter which option they chose. You have 4 options now. They are considered family members now. So service members and family members now have to pay cost shares depending on which option that they use. You have 4 choices. The first way is to go to a military treatment facility such as Grand Forks Air Force Base. They have a pharmacy there, I believe. As long as you're going to a military treatment facility that has a pharmacy on base, you can get your prescription filled at no cost. Your second option is to go to our mail order pharmacy. What this is for maintenance meds, for heart, blood pressure, cholesterol, something that you take every day, a maintenance medication. You're going to have $3 for generic, $9 for name brand, $22 for non-formulary, which is just another tier that they put out there for more higher cost prescriptions. You get a 90-day supply mailed right to your house. For the 90-day, you do have to register for this. Okay, register through Express Scripts. You can go on their website, and I believe that maybe help you guys Express Scripts contact information on it. You get a 90-day supply mailed right to your house. Third option is to go to a network pharmacy such as Walgreens, Walmart, Target, any place that accepts TRICARE, a retail pharmacy. This time you're going to get a 30-day supply for the same price, $3, $9, or $22 for a 30-day supply. Your fourth option is to go to a non-network pharmacy. They're very hard to find, and you can find a Walgreens, a Target, a Walmart, pretty much anywhere. So if you find a non-network pharmacy, you're going to have to pay deductibles and cost shares. So obviously the first 3 ways are the most cost effective. Again, the first way at a military treatment facility at no cost. Second way is our mail order pharmacy for $3, $9, or $22 for a 90-day supply. Third option is our retail pharmacy or a 30-day supply for $3.99 or $22.
Right now, I'm able to get a 90-day supply. Is it changed to 30-day or so Primary you can get 90 days, but with the standard it's only 30.
Are you going to Walgreens or
Right.
that? Okay. Wherever you're going, do you pay $27?
I usually get 3 months, so I pay $9.
I don't know why that would be, because normally at a retail pharmacy, you're only allowed to get a 30-day supply. You have to pay for each, like with birth control, they give you a 30-day supply, but like you have to pay $27. One.
Well, I mean, it's
and I don't-
America's pharmacies, to me, it's just a typical.
And I don't know why they're doing that. Typically, you're supposed to pay a 30-day supply, the $3.99 or $22, $9 for name brand for the first month, $9 for the second month, $9 for the third month. So I don't know why they're letting you do that. So they would have to contact Express Scripts to figure out, or just leave it. But typically you're supposed to pay for each month that you get that prescription.
I was just wondering if it was changed to that.
No.
Now it's.
Because it might depend on the prescription, because we've got a prescription for my son, and it's only 16 days. That's all. So for a 16-day supply, I still have to pay the $3.
Correct. Anything under from 0 to 30 days, you will have to pay that 1 month supply. So even if it's a week antibiotic, you would have to pay that 1 month supply.
Okay.
Any other questions on the pharmacy part of it? Okay. Behavioral health, outpatient care, family members, you're eligible for one evaluation per fiscal year, but you had 8 visits without a referral, but they have to be with a network provider, network psychologist, social worker, or psychiatrist. Okay, so you have 8 visits to behavioral health care, but they must be with a network provider. If you need more than the 8 visits, you're going to need to get a referral. Okay. Inpatient care, there is some inpatient care. I don't believe there's any inpatient facilities around. I think the closest to us would probably be Boise, Idaho, dependent on the situation. So the easiest way to find out about behavioral health care is the easiest one of our programs to access is call our toll-free number at 1-888-TRI-WEST. There's a specific line that says behavioral health. Ask them, explain the situation. They'll refer you to the closest clinic to you where you can go depending on your situation. Okay? If you have other health insurance, like a Blue Cross Blue Shield plan with an employer-sponsored plan, TRICARE pays second to all other health insurances except Medicaid, Indian Health Services, or any TRICARE supplements. So when you go to the doctor, you follow the other health insurance rules first. We come in and pick up any deductibles or cost shares for you as long as it's a covered benefit with us. So do not pay if you have a $20 copayment. Let us pick that up for you. Okay? So show your Blue Cross Blue Shield card or whatever other insurance you have. Show your military ID card. Let it roll through them, then it'll roll through us. Okay? For pharmacy, if you have another insurance, you are not allowed to use our mail order pharmacy. So you cannot use the mail order. But for retail pharmacy, you can. Pharmacies are only allowed to submit to one insurance company right now, so you have to use your primary insurance. So if you pay a $20 copayment for a prescription, you have to pay that up front, submit the claim to us to get reimbursed. So with us, it would have only been $3. We would reimburse you $17. Okay? You just have to take that action to do that.
I have a question back to the mail order.
Mail order.
Can you do the mail order on Prime Remote as well?
Yes.
And it would go to the 90-day supply?
Yeah. Any of our TRICARE programs, as long as you don't have a primary insurance, you can use the mail order. If you have a primary insurance, you cannot use our mail order. Okay.
But you have to register for that on the website.
You do
right?
have to register. It's Express Scripts.
Express Scripts, and it's under.
ExpressScripts.com, I believe, is their website. You can go on our website and find out more information about it and see it.
If you're going to file a
Okay. If you have a primary insurance and you pay a $25 copayment at the pharmacy, to submit the claim to us, you need some information from the pharmacist. So you're going to need a super bill, a printout, or a readout from the pharmacy that says the retail cost of the prescription, the cost your other insurance paid, and the cost that you paid. You're going to get a claim form. Once you get that printout or a readout, you get a claim form. You can get that off of our website. And I don't know what the DD, it's a DD form something. But if you go on our website, find a form, you can find our claim form on there. Fill that out, mail it to Express Scripts, and I believe it's St. Louis, Missouri, to get your prescriptions refilled, or to get your prescription reimbursed. So if you paid $25, and with us it would have only been $3, we would send you back $22. You can go back a year from the date that you got that prescription to get reimbursed. You have a year to submit the claim to us. Okay? Any other questions on pharmacy and other health insurance, or just other health insurance in general? Okay. Certificate of credible coverage is just a sheet of paper that's mailed out to you that tells you the date that your other health or that your TRICARE ended. Okay, this is sent out to your dear's address. So say June 1st, your TRICARE is done. You're no longer eligible for TRICARE. We will mail this out to you to give you dates of when you were covered. This helps you get back into an employer-sponsored plan without some waiting periods or something like that, because this is just your proof that you had TRICARE during these months. And again, this is mailed out.
Prior insurance, is what you're talking about?
For private insurance?
No, proof of prior insurance when you're...
Correct. Proof of prior insurance, yeah. And this is automatically mailed out to your dear's address. So again, we cannot stress enough to keep that address up to date. Keep your dear's up to date. Any questions on what I just went over? You have your 180 days, service members and family members, no matter what program you're under right now. As soon as you're deactivated, you're in TRICARE standard. If you live in a primary, you can enroll into the prime program. Okay, any questions on that? Okay. Now we're going to go over the coverage that you can actually purchase. Every single Guard and Reserve member can now purchase TRICARE. Okay. Today we're going to focus on TRICARE Tier 1, the TRICARE Reserve Select Tier 1, because that's what you're all eligible for, because they served as part of a contingency.
Is that going to be on this pamphlet or no?
We'll go back to that one. Okay, there's two steps to this. The first step is to qualify through their National Guard or Reserve personnel offices. This has nothing to do with us as the contractors. We do not qualify somebody. So they have to go to their Guard and Reserve personnel offices. They have to sign a service agreement that they're going to stay in the Guard and Reserve for the period of time that they want the coverage. And they must be a member of the selected reserve. Okay. The second step is to purchase it, and that is done through us as a contractor. Okay, so to qualify for TRICARE Reserve Select at the Tier 1, must have served as part of a contingency such as Enduring Freedom, Operation Iraqi Freedom, for more than 90 days. Okay. So for every 90 days that they were activated, you can choose to purchase a year of TRICARE. So if they were activated for a year, you can have 4 years of TRICARE. Okay, so for every 90 days that they were activated, you can purchase a year. On that slideshow, highlight, star, circle, do whatever you need to do to get this website down. The Guard and Reserve portal is the first step. They must go on the Guard and Reserve portal to sign this letter of intent, and they can find their verifying official on this web portal as well. A verifying official has to verify that they're in the Guard or Reserve for the period of time that they want the coverage. This is where they sign their letter of intent. They need to print out that letter of intent off of this Guard and Reserve portal. Print off the letter of intent. When they print off the letter of intent, they need to send it to a verifying official. There's 2 verifying officials in the state of Minnesota for the National Guard. Their names are Sergeant Sarah Carlson and Sergeant Christopher Bassett, and they're all based out of Minneapolis area. You can find out who the verifying official for the different service or area that you live in on the Guard and Reserve portal as well. This has their phone number, their contact information, so you can give this letter of intent to them. So just remember, send them to their personnel office to do step 1. Step 2 is to purchase it. You go back into the Guard and Reserve portal to print out our enrollment form. You cannot print out our enrollment form until the verifying official has done what they need to do. Okay, so the step 1 is very, very important because you cannot do step 2 until step 1 is done. You have 90 days from the day that they are deactivated to decide if they want or do not want this coverage. So say they're deactivated February 1st. They have 90 days to decide from that date if they want or do not want this, okay? To purchase it. They have to go back into the Guard and Reserve portal and say, yes, I want this, or no, I do not want this. When they do that within the 90 days, that is not making them take the coverage, okay? Because they're not finishing a step. So it's just ensuring that the option is there for them, okay? So I would suggest that you have them at least go in and say, yep, I intend to take it, even if maybe they're not. You only have that 90 days to decide.
And they don't have to be in the military in order to purchase.
You do have to be a member of the Selected Reserve in order to purchase it.
Selected Reserve, is that
You have to be actively drilling in the Guard and Reserve, a member of the IRR. That you actually have to be a member of the IRR, but assigned to a unit or something. So you have to be drilling or in the Guard and Reserve. So if somebody is planning to get out, not eligible for this program anymore.
Even if they still have the 2 years of IR?
If they still have the 2 years, they would have to go to their military personnel office to verify that they are eligible for the program, because we don't determine that. So send your husband to his personnel office to verify if he is eligible for the program or not. That's why step 1 is done, because we have nothing to do with that. We don't know if they signed up or how many years they have left or anything like that.
So as many years they've got left is all they can sign up for. If they only have 2 years left, they can't, even though they're eligible for 5 years, they're still only.
Well, I would still say, okay, so I said for 4 years, say, and in 2 years they're getting out. I would still say I'm planning on taking 4 years, because you cannot get those other 2 years back, and maybe down the road in 2 years they decide, hey, I want to re-enlist. You have that option that's there. So if they're eligible for 4 years, I suggest say you're going to take the full years, even though if you don't intend to it, because if you only take 1 year right now, you cannot get that additional 3 years back. Okay? So tell them to take it, because if they're planning on getting out in 2 years, things change. They may say, oh, I want to re-enlist or whatever.
But they do have to be actively, I know at the time you purchase it, but during the whole length of the policy or whatever you want to call it here, coverage, if they're not in, they're not covered.
Correct. If they're not in the Guard or Reserve anymore, they're not eligible for the program. Okay, so step 1, personnel office. We have nothing to do with the eligibility. Okay, so send them to their personnel office. Let them know this Guard and Reserve portal address, because that's what gets the ball rolling. They need to go on here to get the whole process started. Purchasing the coverage is through us as a contractor, okay? Again, the Guard and Reserve portal to print out our enrollment form. You can only purchase member-only coverage or member and family. If they purchase member-only and they're married, you cannot change this unless you have a qualifying life event, such as a marriage, a divorce, or a birth of a child, okay? So if they're married right now and they want you covered, make sure that they put member-only or member and family, because you can't get it back. This is our form, the DD form 2896. The letter of intent looks different than this. So the only reason they put this up here is because you need to know that our form that we need looks different than what you're going to send that verifying official. Okay? We need the enrollment form. They have 90 days to do step 1. you have 150 days to do our step, to do step 2. Oh yeah, okay. So you have to get the enrollment form into us as a contractor 30 days prior to your transitional coverage ending. So you have 150 days from the day that they are deactivated to get the enrollment form into us, only 90 days from the day that they are deactivated to decide, yes, I want this program, or no, I don't. Contractors, the May We Help You brochure, depending on what state, make sure you contact us if you have any questions regarding step 2. Okay, here is premiums. This is an actual insurance this time. Everything I was talking about before was entitlements. You did not have to pay a monthly payment for it. This one you do. Premiums are for member only, and this is right now. This changes every year. Right now, member only, $81 a month. Member and family, $253 a month. The coverage is standard and extra. So if you pull out that chart that we looked at earlier, it's the standard coverage. You will have this time, I said, for the 180 days your deductible is waived. This time it is not waived anymore. You do have to pay deductibles dependent on rank. E4 and below, it's $50 for individual, $100 for family. E5 and above, it's $150 for individual, $300 for family. This is an annual deductible. It starts over every October. You will have cost shares, 15% if you see a network provider like the extra column, 20% if you see a non-network provider like the standard. You do have a catastrophic cap of $1,000. Okay, so when you add up your deductibles, your cost shares, your pharmacy co-payments, once you pay $1,000 per family in a fiscal year, we'll pick up the remainder of the charges for the remainder of the fiscal year for the allowed charges. Okay, so max you'll have to pay in a fiscal year for your deductibles, your cost shares per family is $1,000. You can only change, like I said, to change the type of coverage that you want if you have a marriage, a divorce, or a newborn, or if you have a change in employment status. So say you take TRICARE Reserve Select right now, a year down the road, you have a change and you just want to drop it and get out, you can do that. Or if your spouse, I believe, your spouse, it goes by the service member's coverage, not the spouse's coverage. Okay, this is an insurance, so the termination of coverage. You fail to pay your premiums, you will get terminated. I suggest do not just leave it. We will kick you out, but we will expect you to pay for everything that you did not pay. Okay, so it will go to collections if you don't pay. Disenroll, voluntarily terminate or disenroll yourself from the program. Do not just stop paying. Okay. You can only repurchase TRICARE Reserve Select at Tier 1 if they serve again as part of the contingency. Okay, so if they say no, they don't want this from 90 days, they can only have this back if they serve again as part of a contingency at this price. Survivor coverage, the coverage continues for 6 months after a member's death. If it's one family, it would go to member only at this point. The coverage would, so if there was only a spouse, it would go to member only coverage. And if there's kids, it would be member family. Any questions with the Reserve Select for the Tier 1, go to the Garden Reserve portal for step 1. Okay. Any questions on the step number 2, purchasing the program, contact us as a contractor. I know I just went through a lot of information with you guys. Any questions on any part of it that I just went over? Okay. We do have the contact information. The May We Help You is my favorite brochure because it has how to get a hold of us. Again, first step, go on our website, you can post a question, get an answer roughly within 4 hours. You can get an answer to any question. Call our toll-free number. Go into a service center. There's always people there to help you at a service center closest to you. Again, Grand Forks, Air Force Base, Minot, or in the Twin Cities. There's a TRICARE service center available to you